Yeah, I'm coming. I'm sending.
This is my medication card. So I'm just bringing up my report, my assignment as into what it is that I need to do this morning. My medication. I'm getting a phone call. This is my duty as a nurse. Every morning, I'll get a phone call to either, and plus I'm a team leader, so that's taxing too on me. Okay. I need my pen.
Keep your turn that down.
Good morning, which line? Which line is it?
Oh, yes.
Which line?
Bottom line.
Althea speaking, can I help you?
No.
What does a nurse do? A nurse is responsible for do patient care, taking care of her patient, making sure that they're in best health. We try to give optimum care for our patients. Yeah, I noticed they have. On a daily basis, I come in the morning. My shift starts at 7 a.m. in the morning. I take my report from the night nurse. After that, I will go in and assess my patients, making sure that they're not feeling any pain.
It's good to see you again.
It's good to see you this morning, too.
You always make me feel better.
Thank you. Are you feeling any pain?
No, I don't
Okay.
feel any pain.
Just sit up, take a deep breath. I'll check their lung sounds,
Deep breath.
their bowel sounds with my stethoscope. I'll check to make sure that they're able to walk out of bed, which is important too.
No
We
pain.
give out medication. And throughout the day, I'll work alongside with the physicians. And if there's anything that they need for us to do, as the nurse, I'll assist them. Last year, I became the team leader on this floor. The team leader pretty much has to make sure that the floor, when the manager is not here, the team leader is the one that covers the floor. Margaret to the nursing station, Margaret.
Go.
I work 3 to 4 days a week, 12 hours, which is so good because then being a single mother, I have 4 to 3 days off. Sometimes it depends upon your schedule. You can schedule your days off, which is good because we're independent. Nurses are independent. So we can always schedule our appointment, our days off with our nurse manager. We can always have 5 days off throughout the week. And this is 5 days off with your family. So you can always balance it. It has its up, and plus not to promote salary, but that's good reward too. Knowing that you can take care of your family with a decent salary. The steps that you need to take to become a nurse: you need to complete high school. If you can master science classes, that's it, that's a plus. Then you can apply to a college that teaches nursing programs. You have some programs that are out there that teaches 2-year programs, 4-year programs. After being accepted from one of these colleges, you have to do your prereq. So you have to do your AMP. Very important to know your anatomy and physiology. You need to take up other prereq classes, your English, mainly science and maths. Very, very important. After completing your associate or your bachelor's in nursing, you will take the state board, which is the NCLEX exam, and you have to pass that in order for you to be a licensed professional. You have to have it, that's a must. So that's how you become a licensed registered nurse. The salary base of an RN can earn yearly from $50,000 to $75,000, average. Coming out of school, average. To earn more, you need a degree into some form of specialty. This is when you obtain your master's degree. I was working as a medical assistant before, and I was working at a doctor's office. And as a medical assistant, I can only do so much because of my education-wise. And I just feel as if I can do more for people. In general, I love working with people. And because of that, I furthered my education to become a nurse. And so far, it has been rewarding just to know that I'm a blessing to somebody, not just to give medication, but just to listen to them, because they have a lot to say. And sometimes, especially the elders, they never have anyone to speak to. And I just always feel it in my heart to do something extra for them. You were dreaming?
I never saw it.
Who inspired me the most? My daughter, Imani. Her name means faith, and I see why it means faith, because she has really been my encourager. She has been my cheerleader. Ever since she was a child, I always want the best for my daughter. Always. I mean, that's one of my reasons to push more for my education. I'm planning to go to get my bachelor's degree in nursing, and also to push forward for my master's in nurse anesthetist. But she's the one that encouraged me the most to really push forward, because I want her to have a bright future.
What's that one percent to be?
To be
How does the patient travel?
wheelchair. Thank you. Right now, what I'm doing, I'm printing up my patient telemetry strips. It will just let me know the rhythm of their heart rate. All right, telemetry is basically when a patient comes in and the complaint of anything has to do with the heart, if they have any heart blockage, if they have any chest pain, shortness of breath. What we do on this floor, we observe the rhythm of their heartbeat. We place them on a cardiac monitor, and just to make sure that they're not having any dysrhythmias, it beating more than what a normal person heart rate will be.
Great.
It was great. Okay. All right.
One day closer to going home.
To go. Amen. This is the Althea monitor, a heart monitor. So we have to place these leads on in order for us to get a full reading of his rhythm. If he should, God forbid, should have an episode, the monitor itself will pick it up. So it transmits to the screen that I just showed you this morning. Very important as a nurse to always wash your hands.
Please.
Okay.
Make us like twins.
Make us like twins.
Like twins.
Like twins, I remember. Yeah. All right. What makes me feel special being a nurse? Taking care of people and getting positive results. As much as though I'm busy running around with I feel as if my head cut off at times. The most important thing is just that quality. That it may not be a long period of time spending with my patient, an hour, but just that moment. Just to know what are your needs right now? How can I best help you today? How can I fix what's going on? How can I make your stay in the hospital be comfortable? That's make it special, especially when they tell you thanks. That's nice, hearing thanks.
Okay.
All right, okay.
Thank you so much.
Right now, there's a critical shortage of nurses across the country. There are 100,000 available jobs in the U.S., with that number expected to triple in the year 2020. That's 300,000 jobs. The job outlook is wonderful, the salary is excellent, and there's so many different kinds of nurses. You can deliver a baby as a nurse midwife, you can solve a crime as a forensic nurse, and you can be a part of the surgical team as a nurse anesthetist. Me, I teach yoga as a holistic nurse. So come on.
Join the team. Be a New York State nurse.